The spine tells a slightly different story when you're laying down because all of these muscles are now relaxed. All the spinal column muscles are relaxed. So we can dig a little bit deeper into the deepest layer where we find the rotatories muscle and the multifidus muscle. Multifidi, plural, rotatories, plural.
Whatever they're all named, they all hurt.
You're tender here, huh?
Mm-hmm. Like as you go down, it feels like it's more tender on the left.
Okay, thank you. Okay, and so here's what I get. This guy right here, what I feel is that this muscle is the most intense.
Yeah, that does.
And so what this is telling me is that the spine is rotated in this direction, and this muscle right here is trying to pull it back in this direction. So we're going to help it. We're going to correct it and push it in that direction. Okay, what about here, right or left? Is one of these more tender than the other?
More right, for sure.
If I go like that versus this, is that still right? This, or is it just here?
The way you're pressing like that is the right, but when you were just pressing right and I feel it on the left, like I can barely feel that.
But you feel this.
But I feel it on the left, yeah.
Okay. All right, so the musculature is tender here on the right, but the tension is moving in that direction. So it doesn't want to go that way, which means it's pulled this way. The way that we check that is at the cervical spine. Now, everything is connected. The ligaments that run up and down your entire spine are all continuous. We're going to test here. Which is more tender, left or right?
They're about even.
Okay, let's drop down one segment, left or right?
The right.
Okay, let's come back up to 5, 4. Left or right?
I'd say the right still.
Okay, so the right side. Now we're going to come up and test the spinous process. Right, left, right, left.
Oh, definitely left.
Definitely left. So that tells us that this spinous process here in the lumbar spine is moved over to the right, and then it's rotated in a counterclockwise direction. So it's a PRS in this direction. So that means when we correct this, we're going to push it back this way and go clockwise. If I adjust your lumbar spine, first we're going to analyze the pelvis. Test the pelvis here. Let's start with this one. Go ahead and bend your knees.
Both?
Yeah, bend them up. Good. We're going to bring that to here. How's your low back? Any pain, discomfort, tension in your low back here?
No.
And that also would indicate if there's any Logan fibers. Let's palpate the sacrotuberous ligament and see if there's any tenderness there on either side. Okay, right or left here?
A little more on the right.
Okay, so we're going to find that tender segment right there. This is the sacrotuberous ligament. Still tender right there?
Mm-hmm.
Okay, I'm going to keep my thumb right there. Contacting the occiput on the other side. Good. Is this tender up here?
Mm-hmm.
Now we test the different directions and find the resistance. So we go up, down, left, right. So this tension is in this direction. And then from this one, left, right, up, down. Yours is up. And then we just hold these points of resistance, letting the breath and the respiration do the work.
I'd imagine this is what like a string cup telephone feels like.
Oh, a string cup telephone?
Yeah, like I have a feeling this is exactly what it feels like. It's not connected, but somehow it is.
Yeah. First of all, that's brilliant. Yeah.
Feel free to quote me on it.
Okay, let's test that segment again. All right, how's this feel now? Same, better, worse?
Definitely better.
Yeah, it's a pretty amazing technique. Okay, let's do this now. Go ahead and lift your right leg up in the air. Good, down.
The
Okay,
whole thing?
Whole thing. Good, down. The lumbar muscles contract at the same time. Let's do the left. Good, that one was appropriate, down. So the right one contracts first, then the left. On the left leg, so that means the right lumbar is actually fine. So lift up the right one again. Yeah, there was a little bit of a fire on the right previous to the left, which is not the correct chronology of contraction. So that would indicate adjustment from the left lumbar. When I push down on the SI joint, you see a slight rotation of the feet. Now, there's more rotation on the left. Feel all that movement in there? Then when I go to the right, it's just not as much. There it goes. It's starting to loosen up now. Good. So there's good movement there. Good rotation. Is there any pressure, discomfort, pain when I go like this?
Not on the right.
How about
On the
this?
left, on the left.
Is it underneath my hand here, or is it higher up?
It was a little lower.
It was lower. It was
Yeah,
here?
it was wherever, like, I don't know if it was the palm of your hand.
Yeah, okay.
Like, it was definitely near the bottom.
All right, so that's the lower SI joint, which was also tender in the seated position. So let's do this now. Go ahead and lift your right leg up in the air. Okay, looking for the height and the quality of the raise down. Left one, down. The left one actually went higher. Was one more difficult than the other?
I would say roughly the same.
Okay, good. We have a short left leg. The left short remains short. All right, so since the compression test was positive on the left and with the left short staying short, which points to the right SI joint. Now, can you crack your own low back?
I cannot.
Okay, so we don't have any hypermobility issues. That's going to indicate adjusting the SI joint on both sides, and all of this discrepancy that we pointed out earlier with the rotations is a result of what's happening here at the pelvis. So this is going to take priority at the sacrum. We're going to adjust that bilaterally, and then 2 thoracic segments here.
Yeah, what the? Oh. Oops. Oh. Oh.
Yeah.
Oh.